So some of the most commonly asked questions by South African health professionals in private practice is around medical billing, getting your claims approved, PMB benefits approvals and follow-ups, ICD-10 codes, why claims are rejected by medical aids, all of those questions. So I'm going to be interviewing various service providers, whether it's medical billing administrators or software companies, around the issues of medical billing and to hopefully get some answers to your commonly asked questions. In this video, I'm going to be chatting to Vanessa from VMed Billing, who has over 17 years of experience in the industry. If you're new here, I'm Tasneem Abrahams. This is my channel, the Private Practice Growth Club, and I share tips, tools, and tutorials for health professionals in private practice in South Africa. If this is your jam, don't forget to like the video, subscribe, and hit the bell notifications if you want to be notified when I post new videos. Let's get into it.
Okay, basically about us, which is about VMed Billing. Our aim is to offer you quality and efficient results that show you that we really care. Our clients are our priority. Using our systems and processes, we build long-lasting and mutual relationships. We have a passion for success, providing clients and with great quality. Our results are guaranteed to meet our clients' need. Our motivated team is on hand to give you peace of mind, lower cost, reduce of bad debts, and professional service for your patients. VMed Billing will care for you while you care for your patients. Okay, move on to the next slide.
Okay.
The biggest question is you always ask is why do you have to outsource when you can do it yourself? But unfortunately, a lot of practices don't have enough time to actually follow up on their claims, their billing, and it becomes that very frustrating. So we are here to actually focus on your billing and leave you to care for your patients. With all the upgrades and the new demands in the medical aid industry means more time on administration. There are many reasons medical billing is outsourced, such as period of high turnover resulting in staff shortages, and the nature of human resource management, cutting staff expenses, sick leave, and training leave. Outsourcing medical claims enable you to continue earning even during busy periods without increasing your staff. VMed billing will change medical billing expenses from a fixed to a variable cost, improve your ability to manage your business. VMed billing makes your business planning easier, reduce post and telephone expenses, less paperwork, improve security, complete backup of your data, and quick receiving of revenue. Okay, the next slide, Tasneem.
Okay.
Okay, what you can expect from VMed billing is all your fees are based on a percentage on all amounts received. Payments go directly to the healthcare professional, ensuring you to have complete control. Information from your practice is captured on our billing software. Daily submissions on claims to medical aids via EDI, telephonic follow-ups and patient liability and private accounts, secure backup of all your data, provide turnover, income, and debtors reporting after each month end. Okay, the next slide, Tasneem. How long does it take to get started with VMed billing? We basically require your practice information, like your practice number, your address, your banking details, And therefore, once we've established all that information, it will take us within 2 days to submit your claims. We do submit claims on a daily basis. So the next slide, Tasneem. Okay, what sets us apart? Our professional team boasts 17 years of experience in the medical aid industry, competence in billing, rejections, and understanding of all scheme rules and regulations, PMB queries, and ICD-10 coding. Billing is completed daily, and payments from the medical aids are made on a weekly and 2-weekly cycle. We have both the problem-solving and decision-making skills to identify and analyze and rapidly deal with any issue. And the next, as you can see, it's a simple procedure. You fill out a day sheet or a patient form information, you email it to our admin clerk. Once received, we submit the claim to the medical aid. Payments get paid directly to the medical aid. Whatever follow-up that needs to be done, the admin clerk will do that. And then at the end of the month, we will submit monthly reports and a VMed billing invoice to the healthcare professional, and then they will pay us. So that's basically how we operate. And then the next slide, if you want, as you can see, my details are on there. If you want to contact me for further information, you may do so.
Okay, great. Thank you so much. So I think, I don't know if anybody has any question. We have about 6 people that's currently watching. I know a lot more people wanted to join, so they probably will watch the replay. If any of you do happen to watch this on the replay, because as you know, what I normally do is I leave these lives up in the group until I am able to edit it and put it onto YouTube. So if you do watch on the replay and have any questions, please just hashtag replay so that we know when you were watching. But if anybody who is here live, and I see some more people are starting to hop on now as well, if you do have any questions, because now obviously Vanessa's gone over an overview of how VMed billing works, but I think there might be some questions around like some of the specific things around billing that maybe she can share some light on. So I know that one of the questions somebody asked earlier, I think Reshma, was it not you that asked the question around if you are, yes, I think it was you, Reshma, that asked the question around if you are seeing a patient like for 3 different days in the week and you send the invoice out. Let me just find the question so that I can actually ask the correct question, ask it correctly. Let me just see if I can find the question in here. But if anybody has any questions, please do feel free to type it in the comments. Let me just look for the questions that I sent you. Okay. Yeah, here it is. So the question was, if I've seen a patient say 1st, 3rd, and 7th July, and I'm only sending off the invoice on the 15th of July, for date of invoice, should it be the last date that you saw the patient, that is 7th July, or the date you send it off to medical aid being 15th of July?
It doesn't really matter on the date of invoice. What matters is the treatment dates are included on that's submitted to the medical aid. Whenever we receive the treatment dates from the provider, we will submit that claim. So it
Okay.
it doesn't affect on the invoice date. It's
So
actually
maybe
the treatment date is allocated.
So maybe on that point, because you're now saying what's important is that the date must reflect on the actual, as long as the dates that you actually saw the patient or provided treatment is reflecting. So on the subject of what must be included in invoice, maybe you can share that with us. What are some of the important information that you must include when you are submitting claims to medical aid?
It's the medical aid number, the medical aid option, the treatment date, the date of birth, the address, and the most important thing for us is the email address, because in case of the or next of kin information, in case the medical aid rejects the claim, so we can do a follow-up on it. It's easier for us. But for the medical aid, it's the ICD-10, it's the tariff code. And then, that's it, the amount.
And what, in your experience, what has been the main reasons why medical aids have declined or like to pay, or where there's been issues with a healthcare provider actually receiving payment due to them?
It could be that the medical aid doesn't have the banking details of the doctor. It could mean that if the account gets rejected, then it could also mean that the patient details were wrong, information that were wrong, the medical aid number was wrong, and probably the codes didn't match, or probably the you're not allowed to charge one code with another code, stuff like that.
So Reshma actually had a follow-up question. She says that if the patient seen is not the main member of the medical aid, do we put the main member's details as well as the patient's details on the invoice, or what?
No, as long as it's just the patient details.
Okay, so because the patient detail would then be attached to the main member's number.
Yes.
Okay.
As long as you have a dependent code, it will be the dependent 00 or 001. You have that attached. It will automatically link it to the ID number, the date of birth.
Okay. Oh, okay. The date of birth. Okay. So that's why it's important to have the date of birth on the invoice.
Yeah.
Okay, so somebody's asking, how do practitioners communicate to you what you need to bill on the invoice? So that's a good question.
Okay, basically, we have like a day sheet that we give out to doctors. They fill that information with the patient details and the patient, what you're billing for the day, like an ICD-10 and a tariff code. So if they feel it easier to send that day sheet, they can, or if they feel it easy to send just their own patient information with the tariff code and ICD-10, or they can just send, if they send a patient in hospital, they can send a sticker, a hospital sticker, and just send us the ICD-10 and the tariff code that they've used for that day.
Okay. So on the subject of ICD-10, somebody asked on cash invoices. So if you are having your patients pay cash at your practice and then providing them an invoice, whether or not they have medical aids. So on cash invoice, do you still add ICD-10 and treatment codes, or is the invoice exactly the same as you'd send off to medical aid with precise amounts per code to make up your cash price?
Okay, you see, if the patient wants to claim from the medical aid, you'll have to have the ICD-10. You'll have to have the tariff code and the amount, as a normal statement. But if the patient, the reason why the patient claims from the medical aid is due solely for tax purposes or to reach the threshold benefits. So you've got to have that information. But if it's just a normal, if they're not claiming from the medical aid, then you can just issue them a normal invoice. It's fine.
Okay. So standard practice is just issue an invoice as you would for medical aid, just to cover all bases. In the event that the patient wants to claim, then they will be able to do so. Okay, great. And then, so I wanted to know around, you mentioned in your presentation, let me just go and find that slide now. You mentioned something about, monthly reports Where's that slide now? Where you mentioned
The
about
last one.
the
The last
reporting.
one.
Yeah, but there was also something you said, you provide, oh, there it is. It says you provide turnover, income, and debtors reporting after each month end. That must also be a big advantage for somebody who is like, not so in, like for in terms of the accounting side of the
Yeah,
practice.
yeah. We actually outsource that part, the accounting part, to someone that's linked with us. But they need all that information. It's monthly report that has to be given to them.
So if you are a sole proprietor and so you don't have like, such complication in terms of books, it's just basic accounting, you would need your income statement, balance sheet, and you need to submit your income. Basically, you need to submit your turnover and liabilities to SARS. Would that reports that you provide be sufficient to be able to file your taxes?
Yes, you can use that.
Okay. And then you mentioned in the process, let me go back down to the other slide. You mentioned in the process capture and submit claims, and then the medical aid pays. From your experience, what has been sort of the turnaround time for medical aids to actually pay out claims once you've submitted
It
them?
depends. It depends on depends on each medical aid. One medical aid has a run every second week. Another medical aid has a run on every week.
Okay.
So I try to submit. We actually try to submit daily, so we don't miss out those run dates.
Okay.
So yeah. So if the provider can actually send it to us daily, it would make it easier for payments to come to them on a weekly basis.
Okay. So I suppose it depends on the size of your practice and how busy you are. I mean, if you're a small practice where it's just you, a solo practice, it should be pretty easy to prioritize that you put aside time in your day at the end of every day to do your financials, which in the case of outsourcing means sending off your invoicing information to your
Yeah,
administrator, right? So,
yeah,
but I suppose when your practice becomes a little bit bigger and busier, then maybe you want to set aside that once a week you're just going to send everything. But I mean, if you're seeing patients back to back and you're really busy, then you can maybe set aside like every Friday or maybe midweek, like on a Wednesday, you're always going to send your information through.
yeah. I have like some practices that prefer doing a spreadsheet for me, and she submits
Okay.
the whole. She sends like a whole month spreadsheet to me, and then I process. I submit all those claims within 2 days, 2 or 3 days, and then she gets her payments like on the first, the first run in the next month.
Okay. And
And
then
then I have another one. Sorry, then I have another one that submits daily. She prefers it that way, where
okay.
she's getting paid every week or second week.
Oh, okay. Okay. And then I've actually forgotten my question now. Oh, you then in the cycle you mentioned follow up. So what does that entail? And do you do you do you find that you do need to follow up quite often? So I'm just trying to think like for somebody who doesn't outsource this is basically the process that they would have to do by themselves. So instead of emailing the patient form and received by admin clerk, that would be a combined thing where they themselves are compiling the information and then capturing and submitting it to the medical aid and then follow up. How much of time is actually spent on follow up?
You see, it's with us, it's immediately that we get a rejection if the claim rejected, right? And then we follow up with medical aid, why the account is not paid, and it gets fixed. It could be because of a technical issue. It could be because of the benefits was exhausted, whatever the rejection could be. So it doesn't take us much time to actually follow up. But if you were in a practice, you'd be busy on other things rather than focusing on your follow-ups. You'll say, okay, I'll wait for end of the month. When end of the month comes, then it's too late. You must know
Yeah.
the most of the medical aids, um, they give you like a 4-month claiming period to query your claims,
Okay.
4 months, 6 months claiming period to query your claims. So with us, it's done immediately.
That was the question I had. I forgot. I wanted to ask, like, is there like an expiry date of when you can claim for something? So you're saying that most medical aids, it's within 4 months. You need to
4 months,
claim within
and
4 months.
it's either 4 months, and some medical aids it's 6 months.
Okay. And then what I wanted to know as well is, so somebody, speaking about the different medical aids, somebody also asked, how do you register with the medical aids? Do you have any advice on that?
Yes, you see, once you register with BHF, BHF automatically sends out your details to all the medical aids. But they do not have your banking details. You will have to get the banking details form, fill that out with all the documents, and then you courier it to the medical aid.
Okay. And has there been any practitioners that you've come across that have struggled with that process? I know that's come up a lot in other groups as well, where people have complained that they struggled with getting the form there and all of that. Do you have any advice on that?
Not really struggle. I wouldn't say a struggle because it has developed quite a bit to those days, but now it's actually become more advanced. So you just need to call them and they will email you the banking details form, and then you just fill that out and create. And then it's just to follow up,
So,
which we will do for you.
oh, you do that. Okay. So that's what I
Yeah.
wanted to ask. Do you provide any assistance in that
Yes,
process?
we do.
Okay. And then somebody asked, what billing software do you use and what is the license fee for that billing software? Is it very user friendly?
Yes, I'm using the Medis Elite option. It is very user friendly, and the license fee, it depends. It all depends. Like our bureau fees will be separate from a doctor's fees.
Yeah,
So
because obviously
yeah,
you have to be licensed to use it for multiple
yeah,
practices compared to
yeah.
somebody who's using something on their own. And
Mm.
then what I also wanted to know, what is the difference essentially between using a billing administrator like yourself and
Mm.
using a billing software in your practice and doing it yourself?
It's time. It's basically your time because you can be focusing on your patients, seeing more patients, while we are focusing on your billing only. It's
Okay.
basically your time.
And then, and I know that with the accountant that spoke earlier, he did mention also, obviously, it depends on your size of your practice and all of that. So,
Mm.
depending on if you have somebody in-house, then they're going to be doing that function. But if you don't have somebody in-house, then you have to do it yourself. And he actually did advise that when you are starting out and you are solo practice and you don't have employees and all of that front staff and all of that, it is
Mm.
actually better to have an administrator because it's almost like you're having an employee, but they're not an employee, they're contracted out. So it's
Yeah.
more affordable because you're not paying, all the UIF and all of those things that you need
Mm.
to for somebody who's full-time employed, but you have
And
the advantage of,
it's also office space that you use
yeah.
up. Yeah.
So I think nobody else has got any other questions. So I think the last question I want to ask is around, since we're now talking about the cost of employing someone or using a billing software or a service like yourself, would be,
Mm.
you did touch on it where you said it's percentage based. So talk to me a little bit about that. What does it cost for somebody to outsource this kind of service to a company like yours?
Okay, it actually depends on what their turnover is, and then we will give you like a percentage, just say 4% or 5% of whatever amount received from the medical aid or the patients. It's the total amount.
Okay. So there's not like a monthly fee that somebody pays. Do they only pay on the claims?
It's only on the
Or is there
claims
also a monthly fee?
it's only on the amounts that is received from the medical aid.
Okay, so from an affordability point of view for somebody who's just starting as well, then it means they don't have to worry about a monthly cost if they have no patients yet or they're still trying to build. So it's basically almost like a pay as you use kind of service. Is that what you're saying?
We basically have like a contract. You can choose a 3-month contract or 6-month contract. If you are not happy with our services, you can always cancel. There's no obligation, but you need to give us a 1-month notice.
Okay. Okay, great. Well, thank you so much for your time. I don't see any other questions, and that was all the questions that was asked beforehand. As I said, anybody who's watching this replay can still ask questions with #replay, and I'll email Vanessa and see if she is able to provide the answers, and I can give that answers to you guys in the group. And like with all the lives, once I haven't had time to even edit the previous live that we did with Annalie on employment ethics. So that still needs to be edited to go onto YouTube. So I don't foresee that this one is going to go up too quickly because I first need to get that one up. But once I've edited it and put it up onto YouTube, you'll be able to go and watch it there anytime and share it to any of your colleagues that you think might find it useful. So thanks again, Vanessa, for your time. I really appreciate it. Reshma also says thank you. And I hope you have a good evening further.